So in your story, you write that a Seattle area flu study led by an infectious disease expert could have helped detect the coronavirus here in the U.S. as far back as January, and that this was a real missed opportunity. Explain to our viewers what happened.
So this is Dr. Helen Chu, and she's a collaborator, one of the scientists in charge of the Seattle flu study. And when that first case hit America, when we had our first confirmed case, it seems so long ago now, and January 20th, the CDC confirmed a traveler from China. She was contacted by the local health authorities saying, you know, we're going to trace all of this man's contacts. We're going to try to stay on top of this, make sure it doesn't spread here. But you guys are doing this unique study. And what they were doing is collecting hundreds of samples every day from people in the area who had flu-like symptoms. The goal was to sort of track the spread of viruses through a community. And so what better a resource to have on hand? Could they repurpose that to test for coronavirus? And the scientists said, yes, we'll get right on it. We'll create a test. We'll PCR, use little bits of the genome, and we could be ready to do this the first week of February to help these efforts. So they said, well, there's one issue, which is that we are a research lab. So our job is not to test clinical samples. There's actually a separate regulatory sort of infrastructure in the U.S. for that. And that's to protect all of us, right? Because if we are going to be diagnosed with something, we want that lab to hit a certain standard. So she let the authorities know, you know, we're not a clinical lab. Technically, when we test for these things, we can share them among the research group, but there's going to be an issue to report that result. So can we get around it? And so very quickly, she and the state epidemiologist, Scott Lindquist, set about trying to ask that question. Was there a way that they could get around these regulations and bring this lab in? Could they send the samples, for example, if they had a positive test, could they send that over to the CDC to double check it? Because at that time, if you remember back, there was only one place that could test for coronavirus in the US, and that was in the Centers for Disease Control in Atlanta. So the amount of testing capacity in the US was very small. And so they kept hitting roadblock after roadblock. They would send these emails, and we have the emails asking the CDC, asking the state regulators, asking the FDA, can we find some way to do this? And at the same moment that that was happening, there was a real problem with the CDC test. It worked in Atlanta, but when they sent on the first week of February, they sent out that test to the state public health laboratories all over the country, and they had trouble getting it to work. They had trouble validating it, testing it, and making sure it was working. And so that kept that testing capacity in this country so low for so long. All the samples had to be sent to the CDC. The definition of a suspected case remained very narrow. And as a result, as we see now, there has not been a great picture of exactly where this virus is in our communities.